Good morning, YouTube, and welcome back to my channel, Kidney Care Coaching. My name is Stephanie. I want to thank you for tuning in. And before I get too deep into my video, I would appreciate it if you guys would subscribe to my channel, press that notification bell so that you don't miss out on any of my fresh, exciting content. Okay. So in today's video, I'm going to talk about landing that dialysis interview if you're interested in working in dialysis, and do's and don'ts on a job interview going into a dialysis center. Number one, the really big providers, Fresenius and DaVita, they're going to have an online application process. You want to make sure you fill out everything completely. Don't leave anything off, please. And make sure you highlight any experience you have had working with patients that are either elderly, geriatrics, pediatrics, any type of healthcare setting. Even if it doesn't pertain to dialysis, you still want to put it in because it lets them know that you have had experience working in the healthcare field. And sometimes that may put you over another candidate who doesn't have any experience. Okay. Number two, the larger companies are going to have a recruiter that is going to reach out to you first, and they're going to ask you a series of questions just to get a feel for who you are as a person. And you want to make sure you put the best representation out there for you. You want to answer their questions in a quiet spot where you can really think and really give a good answer to put out a great representation of yourself. Okay. And then if you do land the dialysis interview, you want to make sure that you come dressed up. Even if you're running to do the interview on your break from your other job, you want to take the time, change your clothes. Don't come in scrubs, ladies and gentlemen. People do it all the time. Do not wear scrubs to your interview. Okay, if this is a job you really, really want, you want to put the best representation out there for yourself. And I can't stress this enough. Dress up. It makes a world of difference. Number two, in the interview, they're going to ask you off the top, tell me a little bit about yourself. Already have something rehearsed as to what you're going to say. Keep it light, keep it fresh. Don't tell them you're recovering whatever. Don't tell them that. It's none of their business, okay? Not everybody wants to know that. Just saying. No offense to anybody out there who may be recovering from whatever. They don't need to know that, okay? Sometimes people can be prejudiced, and sometimes people can not hire a candidate or push a candidate to the side because of an experience with someone in the past who was recovering from something, whatever, whether it's an illness, whether it's hey, use your imagination. Do not tell them that. Okay? Don't tell them that. It's none of their business, all right? If you're having family issues, don't tell them that in the interview. Okay, we want you to get the job. Don't tell them that. Just rehearse something professional. After you answer the question about, tell me a little bit about yourself, you're going to rehearse something professional to say. Keep 2-3 minutes tops. Okay? Tops. Second, they're going to ask you a series of questions about you working as a team. You want to play up the fact that you work well in a team, right? They want to make sure that you can get along with others, because working in a dialysis session, in a center, not session, I'm so bonkers. Working in a dialysis center facility, unless it's one-on-one, which most of them aren't, you are going to have to work with other people. Whether it's your nurse, whether it's your supervisor, whether it's patients, you are going to work with other people. They want to make sure that you work well with others, okay? That is a strong, strong characteristic they love to see in dialysis workers, okay? Another one is that they want to see your leadership style. Just because you're working maybe as a nurse, working as a PCT, what have you, doesn't mean that at some point you are going to have to use some type of leadership skills, especially if you you see something that's wrong and you want to fix something that's wrong. You want to be able to feel comfortable and confident in stepping up and saying, hey, I saw that this was wrong, and so this is a solution solution I came up with, that's fun. They love people who work well with others, show leadership qualities when appropriate and when necessary. Third, you want to be able to show a time where you did not there was a situation where you didn't get along well with someone and what was the outcome, okay? So you already have this rehearsed in your mind, a time where something went awry at a job or a situation. It could have been something anywhere, something went awry, and how did you handle it? Hopefully, you will have something very professional. So like I said, the three main things: do you work well as a team? Any leadership qualities you have? How, when something did not go well, how did you handle it? Because basically working in a dialysis center, you are working around many different types of personalities. They want to make sure that you're good, you can be reach to higher levels, but that you're not going to come in as a perfectionist. You're not going to come in always complaining about things, but finding solutions. It's okay to identify problems, but it's even better to have a solution, okay? So those are the main things that they're probably going to discuss in the interview: how you work as a team, tell us a little bit about yourself, how you work as a team, your leadership qualities, any weaknesses you might have, and anytime things don't work out perfectly, how did you handle the situation? So you already want to have an answer to these type questions, so they know that you are prepared. They know that you are ready to work. You're ready to learn. Even though you may not even have experience, you want to show that you are willing to learn, willing to take direction, all of those things. And then you can succeed in a dialysis facility. Working in a dialysis center can be very fulfilling. There's room for growth. There's room for other opportunities that you never knew exist. Another thing, after they go through these series of questions, they're going to ask, do you have any questions? Please prepare some questions ahead of time. You might say, what's the patient ratio? How is the learning? How do you teach technicians how to become technicians? What's the teaching style here? Ask them, just ask them some questions where some really thoughtful, thought-provoking questions, Like, hey, what's your management style like here? What's the patient demographics like here? Things of that nature. Already have some prepared questions that you want to ask so that you really seem like, hey, they really want this job. They're really interested in this job. Because sometimes they're going to ask, why did you leave, or why do you want to leave your current position? Okay. Please do not say because of patient ratio as to why you're leaving your current position, especially if you're working in a job that's currently in a healthcare type job. Don't tell them, oh, I'm leaving because I have too many patients at my other job. Don't tell them that. Phrase it another way. Phrase it, well, I really wasn't able to bond with the patients like I wanted to because of constant turnover with other staff. And so we had tell them something along the lines of you not being able to bond with patients as to why you're leaving. You're not really liking the management style as to why you're leaving. Something along those natures, but don't ever say because, oh, I was overworked, I had too many patients. And never, when they tell you the patient ratio in the dialysis facility, you never tell them, oh, that's no problem because I had 13 patients at my other job. Never tell them that, because what you do, even though the ratio typically is about 4-to-1, sometimes 5-to-1 in most dialysis units. Correct me if I'm wrong, some states maybe have different ratios. Some states actually have 3-to-1 ratios, depending on the Board of Nursing for that state. So it totally depends on the state that you work in, what the ratios will be, but never say you're leaving because of ratios, and never say, oh, the ratio is no big deal. Never act like anything is going to be a piece of cake. Never come off like that in the interview, because they're going to think that you think the job is going to be a piece of cake. And when it's not a piece of cake, the first thing you're going to do is run. So never give the impression that the current ratio they've just told you is going to be super easy. Oh, I can handle that. That's not going to be a problem. I take care of 20 patients where I currently work now. Yeah, but you're not doing the amount of care for these patients. You're going to have to do a lot of itty bitty tasks that are very important and very crucial, okay? So like I said, you're going to do a great job. You want to come across fresh, interesting, ready to learn, open to criticism, open to... So I appreciate you guys taking the time to watch the video, and please subscribe to my channel and press that notification bell so that you don't miss out on any of my content. And again,